thank you all for coming. I do appreciate it. Thanks also to Suzanne, I think it's in the States, for inviting me to give this IBS seminar. Talk about the States. I've got this analogy of Manhattan. A lot of us researchers are primary investigators, principal investigators. So our research tends to be kind of research directed. We've got a research question in mind. But from my kind of background, I tend to come at things from a techniques angle. So I've got this kind of avenues and street analogy. And so I think most of you know that probably atomic force microscopy is my main kind of area, although increasingly live cell imaging. So I tend to come at things from a kind of techniques point of view. This gives us opportunities, of course, of being able to, for me to kind of work alongside you, bringing techniques into your research and giving some kind of strength to your research areas. Although I have kind of got my own kind of research areas which kind of go off into various techniques. So some of that I'm going to talk about today. This analogy taken forward into this direction. Got a tablet a few years ago which has kind of changed my life, particularly this application here, Simple Mind. If you want to download that for free, it's I think the full version is a couple of pounds, but you're able to make all these kind of schematics and things, which has been very useful for strategic planning, etc. So the area I want to talk about today is boron neutron capture therapy, BNCT, which ironically, although I thought it would be an avenue direction, it turns out to be yet another technique, so it's a little bit ironic. So I'm going to talk about BNCT, boron neutron capture therapy, what the technique is, its historical context, and what types of compound have been investigated, both worldwide and within our research group. So some of the studies at Portsmouth, and then I'll conclude and talk about some sort of future directions we might be moving into. So you've had some really good talks on brain cancer, brain tumour research as part of these IBS seminars, so I don't really want to kind of go over that, or don't particularly feel qualified to go over it, but I think the take-home message is that the research is very much underfunded, and a lot of the research money goes into breast cancer, prostate cancer, which are more common, but these tumours can metastasize into the brain, about 20% of them. So obviously this is quite an important area for research, and of course once they're in the brain, the prognosis is still quite poor. There hasn't been much change in that prognosis over the years. So what is BNCT? So really it's boron, the element boron, which could be in various compounds, can react with thermal neutrons. So these are neutrons which are quite low kinetic energy. You get this nuclear reaction going on to produce the radioactive isotope of boron, boron-11, and this can then break down to form lithium and a helium nucleus, in other words an alpha particle. It also produces gamma radiation, which we're less involved with. It's this helium nucleus, this alpha particle, and the lithium, which is radioactive as well, which is the agent for BNCT. So why boron? It's because this has a high neutron capture radius. So this element in particular can draw neutrons onto, capture these neutrons to bring about this reaction. So the idea is if we have our tissue with our gliomas, it tends to be brain cancer, we can label the boron in some way to make it specific so it can get to the glioma cells. Then we zap that with thermal neutrons, and then these produce these alpha particles, which generally stay within the nucleus, within the glioma cells, don't diffuse out too far into neighbouring cells. Maybe one cell distant from the glioma cell, and then the tissue can repair. So that's the type of thing we're involved with. Historically, this is not a new technique. It's been around since the 1950s. So very shortly after all the radiation experiments and the World War II, etc. The first glioma patient was treated in Brookhaven in New York, and but 40 treatments were also patients were also treated in that same hospital, but they had problems with side effects of scalp radiation, dermatitis, insufficient neutron penetration into the to brain. So it's normally used for brain cancers, as I say, but anywhere which is accessible to neutron radiation, so it tends to be like surface cancers close to the surface, so melanomas, head and neck cancers, etc. So anyway, these were very low penetration, not really sufficient for the reaction to occur, having all these side effects. Poor boron uptake by the cells as well. These studies were continued. MIT, again another 18 patients, again with similar kind of problems with what I've talked about before. So these US trials were stopped in the early 90s, and things didn't look particularly promising. The story was uptaken in Japan right up through to the current day, actually, using different types of compounds. So there's been different boron containing derivatives, and there was a modest increase in survival in this particular study. In the early 80s, there was some developments in the neutron beam. You could get epithermal neutrons, which had a higher energy and so were able to penetrate further into the brain. So we have slightly better efficacy there. And again, in Japan, studies kept continuing even up to the current day with different studies showing mean survival times had a sort of modest increase in survival times. US trials again started in the early 90s, and in early 2000 there was various European trials, particularly in the group in Sweden, which had some moderate success. But generally the BNCT tends to be the median survival rates were at least as good or perhaps slightly better than standard therapy. So not much of an improvement, but there's still a way to go. These things kind of come in waves, I think, and there's a lot of promise in a lot of new compounds being investigated. So I think these were the main problems with BNCT: the poor selectivity for tumours, accessibility of thermal neutrons. Obviously, you've got to have this in a hospital environment. Last year, I visited the University of Birmingham, which has this kind of environment set up. So in the middle of University of Birmingham, we've got this kind of nuclear reactor, which is quite interesting. And you're able, so they could do these types of studies at the university, and we did in fact plan to do some experiments which are still planned for the future. Neutron beam penetration issues still ongoing, but with epithermal neutrons, I think there's ways to show more promise with this. So this area of physics is still being developed, and the lack of trials, okay, some trials are going on, but they're not as good as they could be. The other factor, of course, is you've got to get your boron compound across the blood-brain, I can never say that word, blood-brain barrier, the BBB. So we've had talks with the seminars about how to do that. We've taken a particular interest in working with liposomes, getting the size such that they might be able to cross the blood-brain barrier, facilitated with monocytes crossing that barrier. So that's something else we need to think about. The advantages of liposomes for BNCT, or liposomes in general, is their small size. So these are typically less than 100 nanometers. Well, this particular type of liposome, less than 100 nanometers, should give us the potential of crossing the blood-brain barrier, and this is achieved by these single unilaminar liposome vesicles, so SUVs. So these have a the phospholipid membrane kind of in a sphere of a particular size should be able to cross the barrier. And as well as that, they can be loaded, of course, with any particular active drug, or in this case, a boron compound. Sometimes we talk about BNCT drugs, but they're not really drugs, they're just boron-containing compounds, which can then undergo that nuclear reaction locally. And so you can load these liposomes with the boron-containing compounds. Also with liposomes, I mean, you can have the conventional types, which are just a phospholipid bilayer with the core, which you can load with drugs, boron compounds, or you can actually derivatize these with various agents. So you can make PEG groups to increase solubility, or you could have cholesterol added between the phospholipid bilayers to make them more stable, and you can so more stable in the blood, for example. Or you can put various charges on to make them attracted to various species. So you can do all sorts of functionalization, which is quite good. The other thing is they're stable as well. So in the blood, these things, you can control the stability. So liposomes have a lot of potential, I think, for BNCT, getting that active boron compound into the region of interest. So boron compounds for BNCT, what's been used? When I first got into this project, which was a couple of years ago, my first question, there's always sort of fancy boron compounds being used, carboranes, etc. My first question is, why can't you just use borax? Good old sodium borate, used as a kitchen cleaner, in effect. This stuff is, since 1881, you've had all these kind of mule trains taking borax out of Death Valley. So why can't you just use borax? So borate. Yeah. So you can't use it because it's toxic. Okay, so it's, as all kitchen cleaners, it's probably not advisable to take it. That's one factor. Of course, then it's also not Pacific, so it has nothing to make that borax go to glioma cells rather than astrocytes, for example. So with these two things in mind, there's a second generation compounds. So this, what they call carboranes, this kind of structure of borons, a lot of boron per molecule. So there's something about being able to get high quantities of boron into the glioma cells, much higher density than the borax. This particular compound, BPA, was also used in early trials. You'll see it's analogous, well, it's an amino acid, phenylalanine in effect. And the idea of this was because if you have a tumour mass, it's using a lot of amino acids, a high turnaround, high throughput of amino acids. So if you can kind of get this analogue containing boron into that environment, that would uptake a lot of boron, and so that was the logic of having that one. And then since then, there's been various kind of third generation compounds, again carborane structures similar to this. The one in particular we've been looking at is carborane itself. And notice you've got the ortho, meta, and para position. So these black circles here are carbon hydrogens. The open circles are boron hydrogens. So you get this kind of cage type structure. And so that's in the, probably remember your organic chemistry, ortho, meta, para coupling. So if you see O-carborane, that's what it means. You've got the ortho positions there. You've got to get this kind of loading into tumour cells in order for the therapy to be kind of effective. So 30 milligrams of boron per gram of tumour. So that's the kind of loading we're looking for. So various other compounds have been looked at over the years, particularly with regards to the liposome work. You'll notice some of these molecules are kind of lipids in disguise, if you like. You've got a polar head or non-polar tail. So this is analogous to a lipid. So that forms the kind of liposome structure with the kind of boron incorporated into that layer. So not particularly a loading of carboranes into liposomes in the sort of conventional idea, but actually having it as part of the kind of integrity of the structure. Again over here, again liposome, different types of structures again with the liposome type structure. Carbon nanotubes, okay, it's very popular drug delivery device, so you could couple carbon nanotubes to carboranes to help the drug delivery in that aspect. This is quite a sneaky one. This is like cholesterol. Cholesterol is used for lipids. It kind of gets in between the phospholipid bilayer, increases stability of liposomes. So if you have this kind of cholesterol analog, so it's a carborane kind of disguised as cholesterol, this can also kind of sandwich in the layers and you get boron into the liposomes that way. These have been reviewed in a paper by John Piero, who did a PhD at Portsmouth in carborane, making various carborane type compounds. This was back in 2007, I think he graduated. So this paper by him you can find in the literature. So the collaborative studies at Portsmouth have been directed by John Sabutlis as the principal investigator here. As I said, John Piero did his PhD here in 2007. He's now at University of Kingston, and we still collaborate with him on the project, particularly because he's got access to inductively coupled plasma mass spectrometry. So you can measure the amount of boron in compounds. Temi, doctored, vivaed but not quite doctored. She had a viva a couple of weeks ago, a couple of changes to be made, the usual kind of response, so she's working on those changes. So in fact, most of the rest of the work I'm going to be talking about is effectively her work. Temi at the moment is in Chicago at a conference presenting the work contained in the rest of this study. And well, I'm going to be talking about sort of two of her chapters in a sense, but there are some other ones which I haven't really got time to talk about. So it's Temi. Teresa was an Erasmus student. She was here last year, so she worked with Temi, particularly on the sort of cell culture side of things, and we got some really good results, which I'll show you shortly. This project was continued by Dare Farrell, and M-Farm final year project student. Again, so that's just happened, and we got some good results, which I'll show you. And then, of course, we worked with the neuro-oncology group, so various guys there who helped with kind of cell culture, etc. Eugene Barbie with the drug delivery. And we got some external collaborators, Dimitri Fitouros, who was a lecturer here. We still work with him, particularly on the liposomes aspect of the work, and Professor Sophia Antisiaris. Also in Greece, we've done some work with kind of making pegylated liposomes this year to make them more stable in blood, and we've loaded those with carboranes and done some quite interesting work too. So that's kind of where we are at the moment. So the aims of this work I'm going to present is, the aims were to formulate liposomes, unload these with a model carborane. So we just use O-carborane. It's not particularly but it's not specific. It's just a carborane structure. We have to see if we can make liposomes containing carborane of the right size to cross the blood-brain barrier. It's kind of less than 100 nanometers. The other aspect was to see if we could make carborane specific in some way. So that early slide I showed with carboranes with the kind of green plus, that's some molecule to make it specific. And what we had in mind was to use these delocalized lipophilic cations, and these compounds, as their name suggests, contain delocalized electrons, so benzene rings everywhere, lipophilic, so it can get into cells, sort of fat-soluble cations, and you might recognize these DLCs as being like Mito dyes. So like JC1 is a delocalized lipophilic cation, and these can get into the mitochondria as a dye. So what we're trying to think of now is, rather than sort of use those cholesterol mimics, actually try to mimic a Mito dye, whereas that you can just stain the mitochondria, not the rest of the cell. You could perhaps do something here, just dye the mitochondria of the cancer cells and not the surrounding astrocytes. And I'll tell you how we make that specific, probably the next slide or two. So something about the specificity here. So this is about making liposomes. This is about making carborane in some kind of specific way which can target cancer cells via the mitochondria. So those were the two aims of this part of the project. So we made liposomes. This is quite straightforward. DPPC, DSPC. I won't try to pronounce these names. But you can see it, they've got a polar head and a non-polar tail. So normal phospholipid bilayer type structure. So different chain lengths in effect. And these were made using the thin film method. There's a whole load of methods for synthesizing liposomes. And we use the thin film method, which is essentially removal of the solvent to produce these liposomes around the kind of edges of the flask, which is then kind of vortex down to produce particles of the right size, diameter. So having made these by the thin film method, we then loaded these with different amounts of carborane, so different volumes of carborane, assessed their size using a zeta sizer. So you can see as you increase the amount of carborane, the size of the particle generally increases. A few little anomalies, but generally increases. We also measured the polydispersivity index, this property here, which is the standard deviation of the size squared divided by the hydrated radius of the diffusion coefficient of the liposomes, and we could see that these were in the range where the particles were monodispersed. In other words, we're having some quite narrow size range limits of these particles. So the size variation wasn't too high, that's what I'm trying to say. We also measured the zeta potential, which is a measure of the stability of these particles. So that's for the DPPC and the DSPC. So we could therefore then make these liposomes of the right particle size, so they're less than 100 nanometers, which was good because that should have the potential then of crossing the blood-brain barrier. Then we did, okay, there's only one AFM image, here it is. So we did some AFM just to confirm that the particle sizes were correct and what sort of morphology we might be having. And then we also used SEM. We didn't think we could use SEM for looking at liposomes because a lot of the literature reports TEM images, but we're able to get some quite good images, and the size correlates quite nicely between the two techniques. So we're just checking the morphology of that really, because all our particle size data was done with the zeta sizer. Then we looked at the stability of these compounds. So we're interested in having the liposomes, but also incorporating cholesterol. So that's the C here, and if we put cholesterol in, which would make the molecules the liposomes more stable, seeing if that would increase the size, and it did slightly, but it was still within the 100 nanometer size, so that was okay. And also we looked at the stability of the liposomes in serum, and we could see that again the particle sizes were slightly larger in that particular environment, but still within the range we were looking at, so that was good. Also on the stability, as well as look at the size, we looked to see if the liposomes will remain intact in this environment. So we had liposomes loaded with calcein, which is a fluorescent marker, so it's a hydrophilic marker. So this is contained in the center of the liposomes, and then we would then expose that to Triton X100, which is a surfactant, and that would then break down the liposomes, release the calcein, which we could detect using fluorimetry. And so from the difference, the intensity versus the background, you can work out what's known as the percentage latency, which is a measure of the kind of release rate of the fluorescent dye with time. So hopefully you can see here that with the purple dots here are liposomes with cholesterol in serum, and these were the most stable liposomes, going down to liposomes just in serum without the cholesterol. So these ones were not particularly stable, but this range seemed to be, these liposomes seem to be the most stable. This is just for the DPPC. We did the DSPC as well. I'm just giving you some example spectra and results here. Then we wanted to see about the loading. So as well as looking at the stability, can we actually get carborane into the liposomes, and how can we prove that? So here we looked at Nile red here. So this particular dye displaces carborane. So if the more carborane you get into the liposomes, the less dye you get, and vice versa. So you've got this kind of inverse relationship. So qualitatively, we could see that as we increase the carborane concentration, we decrease the amount of fluorescence, which is kind of what we would expect. So we're seeing some sort of qualitative increase there. And this was proved quantitatively using this ICP mass spec. So we got made some liposomes containing carborane, and so you digest this with piranha solution, which is a mixture of hydrogen peroxide and sulfuric acid. So we got these liposomes containing carborane, digested them with this piranha solution, and put them in the post. And we had a slight accident in the post, but piranhas escaped. But then we made another batch, and then we drove them up. And then we were able to kind of see how much boron was contained. So this is the mass spec result. So if we had, say, 800 microliters of carborane in this formulation, then we could see that we had exactly the right amount detected by the technique. So qualitative and quantitative determination of that. So that was all making liposomes, so we could get liposomes, make them, incorporate carborane. They seemed to be stable, and we got the carborane in what we thought we had. So that was the first part of the project. A tick on that. That was chapter 2 of Temi's work. So then the next part was to see if we could look at, see if we could label carboranes so that we could target cancer cells. So we looked at mitochondria, as I say. You've got these Mito dyes which kind of go towards the mitochondria, stain them, So these DLC, delocalized lipophilic cations, so you can see how that name's derived. So the ones we're looking at are decrolinium chloride, so this is a dye you can just buy in. And what we did then was to do an anion exchange, so a very simple synthesis of this, swapping the chlorides with the carborane structure. I'll come to the charges and structure in a moment, but well, maybe now we can just say that we, if we reflux that carborane with KOH in methanol, we take off one of these BH atoms, so the top one here is missing. That forms an anion structure, and you've got this this is not a typo, it's a very interesting divalent hydrogen, which I'm still trying to work out what the structure of that would be. Maybe it's quite interesting. Anyway, so that's got a charge. So for each of the two chlorides, you replace it with a carborane. So you've got two of these per molecule. Hence, it's got the name decrolinium bis, because there's two of them. Nido is the open structure. You've got closo form is the carborane form, and then nido is the open cage kind of structure. Carborane salt, and we call that DC, decrolinium carborane. Then we get on to how are we going to make this specific to cancer cells. So there's this thing which called, well, first of all, mitochondria have got this inner membrane, and you get this kind of proton gradient across it arising from the oxygen reduction of water. And so you get this proton gradient across, and you can, this is then used to determine what's known as the mitochondria membrane potential, and it's given this quite grand symbol. So potential difference of the mitochondria, and it gives a measure of the health or level of dysfunction of mitochondria. So it turns out that cancer cells have a different membrane potential than the normal epithelial non-cancerous cells. So it's a 60 millivolt difference, which is quite interesting. And that enables us to have this preferential uptake of these delocalized lipophilic cations. Remember, they're positively charged. So because of that potential difference, and then via this Nernst equation, you can see there's an order of magnitude difference of the potential, 60 millivolts here. So you can draw more cations into the cell for cancer cells. So it's a preferential uptake within the cancer cells compared with normal cells. So that's the kind of mechanism of what makes these things specific to cancer cells via the mitochondria. So the synthesis, as I just said, we made the DC, this decrolinium carborane salt, by, as I say, refluxing carborane with KOH and methanol. That takes off this boron hydrogen, and then you form this potassium salt here, and then you can replace the chloride with the that's the way around. You start with that, and you replace this. So this decrolinium cation you replace with the chloride ion. No, this replaces the chloride ion. Sorry, yeah, you get the idea. It's just an anion exchange. So we made that one. We also worked with rhodamine 123, which is another Mito dye. So this is rhodamine. So normally get it in is the chloride. Again, we just replace the chloride with the carborane anion, so we could form this compound as well. This part was done as a BM Farm project this year. We've previously published some results on this area, again with Dimitri Fichiros using different lipids, and again declinium sold up this. So this kind of work happened at parallel to Temi's work using different liposomes. So, but that work was done using prostate cancer cells, cell line PC3s, and its control. So we wanted to, in Temi's work, actually use cancer cell lines as the cell lines of interest, because ultimately that's what is going to be used for the therapies. So we use IN699, which is a GMB grade 4 cancer cell line from a 15-year-old, so it's pediatric brain tumour. And SMB19s we've also used. This wasn't part of Temi's work, but this work we done afterwards. The idea here is because when we had originally we had IN699 as the cancer cell line, SC1800s as the non-neoplastic astrocytes, the control, if you like. That wasn't really a good match, so we argued whether these results could be published in the Neuro-Oncology journal, because you had different pediatric versus adult, etc. So we went back and repeated that with the project student this year using the SMB, so these should be a better match. So before we actually did the studies, we did MTS Assay just to make sure that the compounds we were making weren't cytotoxic. Well, if you could make it preferentially cytotoxic, obviously the job done, but we wanted to make sure that the BNCT reaction was obviously killing the cancer cells and not the actual boron compound itself. So we did this MTS assay. You can see that it is cytotoxic, but the sort of concentrations involved were much higher than the amounts we would be using for BNCT, which would be way down here at the kind of nanomolar concentration. So we that proved, I think, for the concentration we were looking at, that the agents were not cytotoxic. So we made the compounds. We didn't know if they'd be fluorescent. We changed the anion, so maybe that might have some effect. And it was fluorescent still within the kind of filter sets we were using to detect these things. So that's the diclinium-carborane one, and the rhodamine was also fluorescent, so that's good. And then the rest of the work was really testing them on these cell lines. So this is the IN699 at quite high concentration diclinium-carborane, and you can see the green uptake of the dye within the cancer cells. So that was pretty good. Maybe not all of them stained. If you look closely, there is some green in there. I've tried to overlap the bright field with the green fluorescence, which in some ways is helpful, but other ways not particularly. But you can see anyway, the IN699 sort of took up these cells, but the control cells, these SC1800s, there was no uptake of the dye, even at this very high concentration. So that was pretty good. And also, way down at 1 nanomolar concentration, the dye was still uptaken by the cancer cells, and you guessed it, not by the astrocytes. So that was really quite promising work, which Temi and Teresa, again with the Neuro-Oncology colleagues, came up with to show. So when we did the M-Pharm project this year, I think we did one experiment too many, and we could see that the SMB19 cells at even this high concentration of diclinium-carborane didn't uptake the dye. So that was a bit of a pain. We're still trying to work out why this is. It could be due to some differences in mitochondria membrane potentials, because I'm sure the story is not particularly complicated. We don't. I think we have done some mitochondria membrane potential measurements, but I think we need to repeat this on different cell lines, and maybe we need to have maybe have some kind of way of screening various cancer cell lines with for mitochondrial membrane potential and see how it changes with passage number, etc. So there's a whole kind of study there I think we probably need to do. There was some issues about diclinium-carborane as well, but with the solubility, because obviously by its nature, if it's lipophilic delocalized electrons, the solubility could be an issue. So that, I know the project student was having some issues with solubility this year, which we didn't see last year. So there's some kind of changes to explore there. It might be that we can make this DLC more water soluble, perhaps using polyether groups, etc. So there's some work to be done there. Certainly the work needs to be repeated. Again, so we didn't see it consistently on these cancer cell lines and not on the astrocytes. These are a kind of high magnification before, because I wanted to see if we could see individual mitochondria being stained. But however, with the other dye, the rhodamine compound, we did see uptake of this dye. So that was good. That's with the SMB cells. Unfortunately, the control with this we didn't manage to run, because the cells, the project was coming up, and then the cells, the SMB, the SC1800 cells didn't grow up properly. So we haven't got a control set for that. So it definitely needs to repeat it. So that was a bit of a shame. I blame Sam for that one. No, not really. Right, so to conclude, we've made carboranes, we've got the right particle size, what should make it possible to cross the blood-brain barrier, and this was confirmed with AFM, SEM, etc. And these tend to be stable. And we've then looked at specific targeting to try and get this delocalized lipophilic cations derivatized with the carborane, to try and get that into the cancer cells preferentially via this mitochondrial membrane potential. And so that all looks successful until we tried this SMB19 cells, and we talked about some differences, reasons why that might be the case. However, that kind of this RC, this rhodamine 1,2,3 carborane, does, however, stain, although we got some control issues to try. John Piero did try this RC with PC3 cells and found them to preferentially take up the cells, and then he had the control prostate normal cells which didn't uptake that. So even with this RC story, we kind of proved the preferential uptake. So there's a few more experiments that need to be done. It's an ongoing project. It all looks fairly promising, I think. And the declinium-carborane was not cytotoxic at the concentrations we're looking at. So finally, I just thank all the collaborators and people who have helped us with the project, and thank you for your attention.